This is the third letter in a series of 4 that Dr. Dan and I are responding to for the Ask the Therapist series from PsychCentral.com. And so, Dan, this is our next letter, and it's entitled Strange Anxious Feelings. It's by an American young woman who's 19 years old. And she says, I've been dealing with excessive worry since I was a child. I'm a psychology major, and after studying this for the last 2 years, which I will say is always a dangerous thing, I have found that my symptoms may be an anxiety disorder, if not more than one. I have general anxiousness of which I cannot always explain. Persistent worry that has lasted for a long while. Also, when I get weird physical symptoms or feelings, I get freaked out and think, this is really serious, and I sweat, have heart palpitations and tension. It doesn't last long. I do breathing techniques. I feel like this may be a panic attack. I've been to the doctor recently, but only have discussed my allergies and other health issues because I'm too nervous to mention my feelings because I never have. Talking about my allergies is normal. It would stress me out too much if I brought up anything new, but the test results of the physical were normal. So I'm concluding that these physical symptoms are really about anxiety. I also have a habit that calms me down. I constantly rub my eyebrow when I'm nervous to the point it causes abrasion and rubs the hair off over time. I otherwise have a very normal life, a loving family, great friends, great boyfriends. I'm a B student in college. This just seems like something I've never been able to understand. If you could clarify my feelings for me, that would be wonderful. Thank you. So, what do you think?
Yeah, I think she's talking about, and not to just throw out a diagnosis, but she used all the terms, you know, a general anxiety disorder, you know, that kind of thing. And those are tough because it's hard to pin down where it's coming from. It just seems to bubble up from nowhere. You know, the fact that she's functioning well, and that you know, she's doing good in college, she has a boyfriend, she's got a social network. There's 2 things that I think I would really very highly recommend. One is to consider looking at mindfulness-based stress reduction, because I think the idea of her having a meditative practice that's specifically focused on stress, I think would be very helpful, because she'll be more in tune with her body and able to manage the anxiety. The second thing, which I know is going to produce anxiety but ultimately reduce it, is to see if she could join a group. A group for social anxiety. You know, if she's at the college, truth is most college campuses now have groups, and just being part of a group and recognizing that your anxieties and your fears and your concerns are not in isolation, that other people share it, that universality can really help you move through it. So those would be the 2 big recommendations I'd have.
I have one other. She talks about being nervous, about talking about being nervous with her physician, and it could be, I would want to at least make sure and have some blood work done that maybe her thyroid isn't exactly what it ought to be doing.
Yes.
I just want to make sure that she has a totally clean bill of health. And she says that everything came back normal, but he also didn't know to look for the things that might in fact be causing some of this anxiety. So there are some vitamin deficiencies that can cause this kind of concern. So I'd want to make sure that her physical health is okay, and if she's anxious about talking about this with her physician, another thing she can do is show him this letter.
Yes, of course.
And just say, I'm too nervous to talk to you about this, would you mind reading this?
That's right.
And that will maybe help her be more willing to disclose to her physician what's going on, so that she can just make sure, let's rule out a medical problem.
Right.
And make sure that it's an emotional one.
You know, I really like that too, because if she keeps it focused on the medical and says, you know, I have this, but I've read about this on the internet or that, it's a nice entree to the physician, because then he or she can check it.
Yeah, okay.